Good morning, good afternoon, good evening, everyone. My name is Gabriel Undelikwo. I work for UNH Nigeria as community support advisor. I also have some responsibility for prevention for key populations. By way of housekeeping, I would just want to welcome each and every one of us to this webinar. The prevention outcome webinar by way of logistics. I want to encourage each and every one of us to use the Q&A or the chat box to introduce ourselves, simply the name, the organizations, and the country where you are joining us from. We're quite happy to have each and every one of us here, but also to say that we look forward to an engaging, productive webinar. And for that reason, it might be tempting to multitask, but I want to urge each and every of us to be very attentive and also avoid the issue of trying to do an additional task inclusive of being here in this webinar. So it's delighted to see such a good number already join us, diverse as we are. This webinar is very important for us to share insights and deepen our understanding of how we can effectively utilize available tools to monitor and evaluate the outcomes of our HIV prevention efforts. So upfront, once again, I want to commend all of you who have joined and also thank the organizers for putting this very important webinar together. Some critical points I would just like to emphasize. One is, of course, is the fact that prevention remains very fundamental and essential for us to achieve our broad goal. And our broad goal is indeed to have a zero new infection. And also want to emphasize the point that in the light of the current funding landscape and challenges, we need to really, we're beginning to think of reprioritization and indeed termination of some programs. It is very important that we reimagine and refocus our efforts on prevention and in all our advocacy and engagement to ensure that prevention remains a core component of sustainability. I also just want to emphasize the point that it is quite obvious that commendable achievements and also results have been achieved with regards to our prevention efforts as it relates to the diverse populations that we served. But also various tools are available to support these efforts, each of which is unique application and benefits require that we effectively understand and utilize these tools. For us to create an effective, inclusive, and sustainable interventions. And of course, for us to be empowered, we really, in terms of decision-making, we also need to have the benefits of two providers to those kind of information. I want to recall that we had a prevention outcome monitoring workshop in Botswana in September 2024. So I see this webinar as a logical follow-up to that workshop, as it provides us with an opportunity to reflect on the outcomes and, of course, to extend the dissemination of the emerging tools, guidance that arose from that workshop. I think this workshop or this webinar also will provide us a platform to gain new insights, provide some guidance and understanding on the significance of these tools in HIV prevention programs, and of course, explore emerging issues that arise thereof. I just want also to emphasize the point that tools and strategies that we deployed must not only be effective, but they also need to be adaptable to the ever-changing landscape of public health. And so monitoring and evaluation prevention outcomes are essential to ensure that our programs are making a real impact and we identify areas for improvement. During this webinar session today, we're going to hear from our colleagues and experts in the field who will share their experiences and insights. And we would like to have the opportunity to engage, meaningfully discuss about the challenges, the success that we have recorded using some of these tools and information in our work. I think the overall goal I want to emphasize is for us to share knowledge and also deepen our knowledge of tools available to enhance our monitoring efforts, ultimately leading to more effective and impactful HIV prevention programs. I want to employ each and every one of us joining us today that your participation and contributions are very invaluable. And I want to assure you that we look forward to learn, to share, and to collaborate for a healthier future, better outcomes in our prevention efforts. And so once again, I want to encourage each and every one of us that translation is available in French, in English, and Portuguese, and also encourages us to listen and engage effectively, utilizing the Q&A as well as the chat box to share our thoughts, our questions, and also our comments and observations, which will be taken at the end of the presentations. I also just want to say that your valuable contributions, your engagement is very, very critical for us to achieve the intended objective and purpose for this webinar. Once again, I want to encourage each and every one of us to be very attentive and to commit all our efforts to ensure that we get something meaningful and productive out of this session. Thank you once again for all your efforts. Thank you once again for being part of this webinar, and we look forward to a very engaging sessions moving forward. So I take those as my opening comments and remarks, and just use this opportunity to introduce the very first of our colleagues that will lead us in their presentations. And I just want to use this opportunity to welcome those our colleagues and encourage them to, as much as possible, share with us in this 1 hour, 30 minutes we have their thoughts and their presentations. We give each and every one of the presenters 10 minutes to share their thoughts. And of course, thereafter, we'll take the next session. And like I mentioned, the Q&A will follow thereafter. And I just want to encourage us to listen attentively, to engage, to share, to understand. Our three presenters in the session will be Shona Dallard from WHO. We're so happy that Shona is joining us and ready to share with us her insights and thoughts. Clement Bentike is expected to stand in for Lucia, our colleague. So I believe he will also be available to share with us his insights and thoughts. And of course, we have our dear friend from Global Fund, Annette Garrison. We're so happy that you create time to be part of this session. Once again, I just want to encourage each and every of us to be attentive as I invite Shona to just take us in her presentation. Shona, over to you, please.
Thank you so much, Gabriel, for the warm introduction. Good morning, good afternoon, good evening, colleagues, wherever you are. We are so pleased that you can join us for this summary report of an HIV prevention outcome monitoring workshop that was held in Botswana last year. So, of course, a huge thanks to the co-sponsors, that's Global Fund, WHO, UNAIDS, and PEPFAR, as well as the government of Botswana for hosting us. So I'll be talking now and giving you a brief overview of the report, and as well as some details about the WHO guidance that we have before turning over to my colleagues, Annette and Clemens. Next slide, please. So this report, so we'll first cover the different parts of this report, but I'll just start here, which is gives you sort of a high-level overview of the workshop and what it contains, including the prevention outcome monitoring tools and some of the synthesis of the key insights that we gleaned from this workshop. So the first section was an overview. It includes workshop details, the agenda, some of the background. Section 2 covers the showcase of the tools and the guidance, some of the methods that can be used, some of the synthesizing information, how to go about measuring HIV prevention outcomes, a granular assessment of programming, and some cross-cutting analyses. And then section 3 really focuses on the insights and actions that we gained from the workshop with, I believe, 21 countries were there, and then lists some of the follow-up actions. And then, of course, you're welcome to get in touch with the South to South Learning Network and any of us. We're more than happy to hear from you, and it's nice to see several familiar names in the participant list. Next slide. So to go over the workshop, so the dates, as you can see, were in September last year. It was held in Botswana. The conveners were the South to South HIV Prevention Learning Network, and they did a superb job of bringing everyone together, managing the logistics and organizing the different sessions. There was the Bureau of Global Health Security and Diplomacy from PEPFAR, the World Health Organization, the UNAIDS, and the Global Fund. And here you can see the list of countries, and the participants included people who were from the Ministries of Health or from the National AIDS Council. There were some Global Fund principal recipients or sub-recipients, as well as UN officers, PEPFAR, and others who were champions. Moving ahead, next slide. So the workshop was 2.5 days long and covered several different formats. They included presentations, there were skills building sessions, there was group work, and of course, as with any workshop, there were networking opportunities, and there were a lot of discussions between different country members and different colleagues who were there. So the first day really focused on setting the scene and orienting participants on the existing tools. So this is where global stakeholders, primarily WHO, UNAIDS, Global Fund, presented on the existing guidance that we have put out for prevention outcome monitoring. And then countries also shared their experiences in terms of the challenges and successes with prevention outcome monitoring. And we know that monitoring HIV prevention is very difficult because it's not like treatment where there's a very set a sequence that has to occur once somebody has been diagnosed with HIV. Prevention can be used at will, stopped and started as appropriate, and can be very difficult to monitor. So we listened and heard a lot of interesting experiences there. On the second day, we focused on disseminating practical information on the tools specifically. So here is where countries and stakeholders came together, they had presentations, they focused on particular areas and particular tools, for example, on community-led monitoring, polling booth surveys, the BBS Lite, that's the Biobehavioral Survey Lite, rapid coverage surveys, and others. And then on day 3, we moved to focusing on action. So this is where countries worked on drafting their GC7 country plans for prevention outcome monitoring, and that's really for the Global Fund, as well as having discussions and resources on how to mobilize to support prevention outcome monitoring. And then there were also a specific roadmap and action plans to strengthen their prevention systems. Next slide. So essentially, the workshop brought together countries, stakeholder, technical experts, everybody concerned and interested about delivering HIV prevention as a first, but also to look at how it was reaching the intended recipients and what some of the main outcomes would be and how to measure success. So it came as an express need of the Global HIV Prevention Coalition. There was a think tank meeting back in 2022 to look at how to measure combination prevention, and there was this gap on prevention outcome data. And so that's what this workshop was trying to address, some of those issues. And again, it was hosted, a similar one was hosted by the South to South Learning Network back in 2023. So the objectives of the workshop were first to provide an overview of the guidance and tools that are available currently. Secondly, to share and learn from country experiences with HIV prevention monitoring. Third, to draft country-specific prevention outcome monitoring plans. And then fourth, to kickstart implementation for one of the tools that were included in the toolkit. And this was really specifically for, as I said, the Global Fund. So I'll just focus the next few slides on our WHO guidance before turning over to Annette and Clemens. So for us at WHO, the guidance that we have put out there are several. The two most important ones are the Consolidated Guidelines on Person-Centered Strategic Information, which were released in 2022. And the second is the Digital Adaptation Kit for HIV. I'll describe these just in a little bit of detail, but essentially the idea is to focus on person-centered monitoring. And this is through the cascade for prevention, testing, and treatment. Prevention is in Chapter 2, and it's for the first time that we've put forward the use of a minimum data set to capture key events in a system as an individual interacts with the health service, and then to be able to monitor that information over time and to do retrospective analyses where needed to look back and see where were some missed opportunities for prevention. So the underpinning principle between this is, for these guidelines is data are collected day to day all the time as part of routine program delivery. And the idea is to collect that data once and use it many times for different purposes. So that's the focus of the consolidated guidelines. And these prevention data can then be used to construct cascades and, as I said, to do several different types of analyses. It also can be used to identify individuals with prevention needs. So for example, one of the most predictive factors for future HIV acquisition is having a previous STI, having a partner who is HIV positive, or a partner of unknown status. But at least for STIs, if that comes up in the system, it is an indication that this may be a person who may benefit from HIV prevention. So there's a whole section there that deals with prevention need, risk, and how to deal with prevention monitoring in that routine data system. I think now, given the challenges with funding, routine systems are going to be ever more important, and capturing valuable data, just the core, what's essential and necessary, is really important. So highlighting again the importance of having that minimum data set, which is just the core pieces of what's essential for monitoring. The second document is the Digital Adaptation Kit for HIV, and this is the second edition. So this is part of the WHO SMART Guidelines initiative across all diseases and conditions. And the idea is to take these WHO recommendations and guidelines and to translate them for digital systems and countries. So the Digital Adaptation Kit is to aid in the transition to digital systems and uses standardized format and international standards for defining data elements and what they mean for digital systems. So it consists of a PDF and 4 Excel files, and you can find this all online, and hope that's helpful for you. We also have a DHIS2 prevention tracker. Many countries use DHIS2 for aggregate data collection and analysis at local, subnational, and national levels. And the prevention tracker enables, for the first time, individual level prevention monitoring. And we have included sort of HIV testing. And so there's a case surveillance tracker and a prevention tracker. So the prevention tracker keeps track of individuals who are receiving a prevention service and captures several different aspects of their care. If they then test HIV positive, they can move to the case surveillance tracker. And all this information can be downloaded at the website here and also can be adapted as a country needs. So as part of this, and I should also say that the prevention tracker covers all the different prevention interventions as well as STIs. And in the case surveillance one, we have TB, as well as cervical cancer. So there's several different aspects there that can be used depending on the country desires and what is appropriate for your country. So during the workshop, what we did was we asked countries to look at the minimum data set of what they had already in their national systems, and then we gave them feedback on the last day, and you'll see that on the next slide. So here is the summary of the assessment of readiness for national surveillance systems to analyze routine data on HIV prevention. So during the workshop, we gave the subset of HIV prevention from the minimum data set to map to their national HIV data systems. So we assessed 60 data elements across registration, so patient registration or client registration, HIV testing, prevention, and vertical transmission. So this then, having these data in your system means that you can analyze different prevention-related indicators. So what we found was that countries were at a varying level of data element availability, and you'll see on the right bottom of your screen, in green are the data elements that are available. Each column from A through M are the countries, and they fill them in. And on the left is the indicator name and the data element label. And what we found was there was really good availability of HIV testing data, condom data, PrEP, PEP, and vertical transmission, but really quite limited availability for needle and syringe programs, OAMT, STIs, and some of the behavioral data elements. So as a result of this review, we presented these on the final day of the workshop. One country had everything, that was the superstar. We then had plans, countries made plans on how they would update their health information systems with these recommended data elements to improve the prevention outcome monitoring for their programs. And I think that's it for me, and I turn over now to Annette. Oh, sorry. Yes, the countries then on the last had an opportunity on day one to talk about their prevention outcome monitoring practice in their country marketplace. And they had these wonderful posters where they had different aspects that were covered to look at existing resources, any planned data collection activities in the near future, what were the gaps, what were some of the challenges they had, what were some of their best practices in utilizing data, and the current challenges. And I think there were some very unique and interesting aspects, and there were some that were consistent across countries that we saw repeatedly. For example, monitoring people over time was a challenge. Lack of unique identification was a challenge for prevention in particular. If someone was receiving multiple services, it was hard to track them. So these are all synthesized very well by the South-to-South Learning Network. And really, it provides an opportunity for us to reflect both on for each country to look at how they can improve their own individual system, but for us at the global level and for others who are interested to look at what are some of the best practices in different places, or how we can address some of the common challenges that occur in many places. And we know that with prevention, this is a challenge. And now I do think that was the last slide. And then it's to Annette.
Thanks, Shona, for this.
Thank you so much, Shona, for the presentation and the synopsis you have provided. Very great, very succinct, and very clear. Particularly note the country plans that were developed, the data sets, and of course the posters the countries came up with. They were quite instructive, and I thought I needed to emphasize those components. I believe that colleagues and participants in this webinar have listened attentively, and I would just want to urge each and every one of us, your comments, your questions, kindly utilize the chat box, the Q&A, and share them with us. I also want to assure a colleague who has asked whether a copy of the presentation will be shared. Just want to assure all the participants that copies of the presentations and recordings will be shared thereafter. Just want to provide that assurance. Thank you so much again, Shona. And just be on readiness to take the comments and questions at the end of all the presentations. So I just want to move straight to our dear colleague, Clement. If Clement is here, can you just quickly come on? Clement is UNH. Clement Benedict, can you just come up and share your thought with us, Clement? So nice to see you again, Clement.
Hello. Great to see you also, colleagues. I still see Annette's slide up here.
I believe I'm next.
Okay. Oh, Annette, you are next.
Annette.
Okay. Okay, great. Over to you, Annette.
No problem. And thanks so much for Shona starting off. And nice to see so many familiar names from the meeting in Botswana, and also some other people that are interested. Really nice to see. Next slide, please. So there is a range of tools and methods to measure and determine and to visualize HIV prevention indicators along the results chain. Some of those are listed here. I will specifically focus on number 2, the results framework for prevention, and number 4 of measuring prevention outcomes. And Clemens will then, after me, go into the other tools that are listed here. So let us move on to the next slide, please. So the work at the Global Fund relating to prevention outcomes started actually with developing a prevention results framework. It's very small here on the slide, but critical to this work actually, because what we realized, prevention is much more complicated than treatment, in the sense of you test people, you put people on treatment, and you see if they're virally suppressed. For prevention, there's different populations, there's different interventions, and each of these interventions have their own outputs and outcomes. But what is very important and what is made very clear in this results framework, all these interventions should eventually lead to people protecting themselves from getting infected, so using prevention options, which eventually then hopefully leads to less new infections. And the reason why we emphasize the outcomes is that, so it's not enough to reach or to cover people with interventions. We also really must know, are they using these options? It's also difficult to measure coverage, and also people are accessing services outside of what we call like the regular programs. And if you look at purely at the new infections, those are largely also influenced by treatment as prevention. So measuring the results of our prevention activities is really focusing on these primary outcomes. So the next step was that we actually realized that there's limited data available on prevention outcomes. These in general come from the large-scale surveys, but only every so many years. And we felt we really need more outcome data at the implementation level in order to change programs. So we developed what we call the Prevention Outcome Monitoring Toolkit. So it's not a new tool, but it includes 3 methodologies that have been developed as an alternative to like the large-scale surveys. And we really want to use those methodologies to measure prevention outcomes more routinely. So it's in addition to the larger scale surveys, which really focus on like national representative data. And it's also in addition to the program monitoring that Shona talked about, because that often goes up till the output level. Next slide, please. I'll just briefly touch upon each of the 3 methods that were presented during the meeting. And for the first one, the polling booth survey, we actually had like a mini polling booth survey during the meeting. So the polling booth survey is more an interview method. It's a group interview. And the reason why it's not individual, it might reduce reporting bias. So it's rapid and more frequent, hence serves the purpose that we were looking for. And it's really meant to inform programs. It has been used in Kenya for several years already for key populations, and under the Global Fund Strategic Initiative for Adolescent Girls and Young Women, it has been piloted in a set of countries. Next slide, please. So you're all familiar, I assume, with the BBS surveys for key populations. There's now also a BBS Lite survey. There's a lot of discussion on the name because it's lighter, but it also has a different purpose because it's really a program-based. It makes use of facilities and outreach, and it's really a method for actionable information on key populations to improve service delivery and guide decisions on programming. It's quicker and cheaper, but it has its own purpose besides the full-scale BBS. Next slide, please. So, and the third method included in the POMT is the rapid coverage survey. It's also a simple, inexpensive way to measure reach and coverage, but also outcomes of HIV prevention, care, and treatment for key populations. Eswatini has, however, also piloted for adolescent girls and young women. There was USAID support for this methodology, which will now change due to a falling away of USAID, but the guidance is still available, and it can be implemented and still even without in-country support. So this is another way for both key populations and AGYW, and it's really focused on a hotspot or place where adolescent girls and young women would come together. Last slide, please. So how are we now at the Global Fund taking this work forward? So we really asked countries during the meeting, based on the plans that they developed, to have in-country follow-up meetings, because we only had limited number of participants per country at the Botswana meeting. So we really wanted the results to be shared with a larger group in country, and then also take the draft plans a step further. So, so far, most of the countries have conducted follow-up meetings, and at this stage, there's 10 draft protocols developed. Some were actually based on earlier work. As I already said, we had the AGYWSI, and Eswatini already implemented the rapid coverage survey. South Africa had already embarked on implementing BBS Lite with UNAIDS support, and the first preliminary results are available from that. And Kenya already conducted earlier rounds of the PBS. But Indonesia, Mozambique, Tanzania, and Uganda so far have developed protocols, and Mozambique already implemented as well. And Uganda has started, I believe, last week. Although with the current funding landscape and changes, there's also some of the work that has been paused. For example, in the Southern Africa countries, we really rethinking where Global Fund should be implementing if USG implementation isn't continuing. So it's felt that we should put this work at the moment a bit on hold because the program might change, hence the measurement might change. And it's similar in other countries as well, where we really need to see, is this feasible at this moment? Other challenges are that even though we've been talking about outcomes, it's still sometimes difficult because implementers would go up to outputs so far to really change the thinking, like going a step further to measure outcomes. Another a difficult step is because everybody knows the big scale surveys, a lot of the initial draft proposals we were getting for the prevention outcome monitor were still trying to come up with a representative larger scale survey. So it's very important that the guidance on the lighter surveys is really internalized. So how are we now taking this work further? So we're following up closely with countries to see what is feasible in terms of implementation, but we're also looking at even more cost-effective and lighter approaches, maybe making use of mobile survey platforms, so that it can really become part of routine monitoring and not be a separate exercise. And we are currently, there's an independent evaluation of the HIV prevention work at the Global Fund, and part of that will also be developing and piloting a tool to evaluate the work done so far, and we're going to even after the evaluation want to use those tools if there's further evidence collected, so that we can come up with a set of lessons learned. Because the real goal of this work is that we learn lessons from this implementation and see how we really can improve prevention outcome monitoring further in the future. That was it for me so far. Back to you, Gabriel.
Yeah, thank you so much, Anne. That's very great. Thank you. Very, very eloquent and very clear. But particularly notes the fact that there was a follow-up with countries, and the table clearly shows where the countries are. And of course, we also note the challenges you enumerated, and we hope for better outcome moving forward. So thank you so much once again. I just want to also use this opportunity to encourage participants to utilize the Q&A box, and let's have your comments, your questions, and also your observations. Quickly, we'll just move on to Clemens. Clemens is Global HIV Coalition Secretariat in UNH. Clemens, over to you, please. Thank you, over.
Thank you so much, Gabriel. And I'll be looking at a number of tools in the Global Prevention Coalition, and that, of course, includes primarily all the countries that work with the coalition are used to synthesize prevention data and interpret and analyze it. And I've just posted into the chat the link to the Global Prevention Coalition webpage, which has all those materials that I will be presenting. So the Global Prevention Scorecards are really a high-level synthesis tool for HIV prevention data. And what it means to do really is to give the data actual meaning and provide a synthesis analysis of the status of prevention in a country. And the scorecard is available, of course, for all countries that report to UNAIDS Global AIDS Monitoring. The scorecards for 38 countries are then published on the GPC website, but even for the other countries, they can contact us, get the Excel file, and actually look at their own scorecards. It's really used at country level to do high-level gap analysis, for example, in the context of developing a national prevention plan or a Global Fund application. It captures data along a results chain. So if you look at what we see here in small print, the example for Kenya on the left here, the first column, you have the coverage and output indicators. So for example, how many people are reached, how many condoms are distributed, how many circumcisions are done. Then the next column in the middle is the outcome indicators. So that's the utilization of prevention. And then to the right, you have actually the impact indicators in terms of what the trends for HIV incidence are, and then also for key populations and prevalence indicators as a proxy for the HIV burden, and also the new HIV infections, at least as a proxy in terms of prevalence for young populations. You have that there as well. So it helps basically interpret where the prevention response stands at the larger scale, but it can also be, and that is a new offer that we have, and that requires country engagement, be done at subnational level. And we have a subnational scorecard template that can give a more granular, localized insight, and it has been used in Mozambique and Zimbabwe, for example, to actually do subnational analysis. And if you compare to other, applications like AIDS Info or other UNAIDS tools where you will find some similar indicators, one central difference in the scorecard is that it assigns a certain assessment or interpretation to the data. For example, 60% would be a very high coverage, and in the green for opiate agonist therapy, but it would be, for example, for another indicator like use of safe injecting equipment for people who inject drugs, or for condom use among sex workers, 60% would be very low. And often when we look at the data just in terms of numbers or bar charts, we don't necessarily assign that meaning, and the color coding actually provides for each of the indicator, whether it's output, outcome, or impact, a level of assessment against progress. And of course, there's much more detail, including a summary of the 10 actions that you have in the Global Prevention Coalition roadmap. Those are more on the stewardship of prevention. Those are also assessed in those scorecards. Next slide. And you will find them under the link. The prevention self-assessment tool now is a much more granular tool, and it's really more a program management assessment tool that goes very much into the details. So it's nearly at the opposite spectrum from the scorecard, which provides a very high-level summary of the entire prevention response. In the prevention self-assessment tools, one looks at specific pillars of prevention. So it's organized around the pillars like condom programming, ARV-based prevention, key populations, young women, boys and men, and it then looks into different elements of the management, the monitoring, the capacity, the different implementation channels, and assesses whether all the key elements of a successful prevention program are actually in place. And it has also been primarily applied at the national level, but some countries, including Nigeria, have gone to the subnational level and thereby developed more nuanced insights. And SSLN has a number of additional visualization tools there too, and you see some of them represented here in terms of summarizing the outcomes. So that's really a very helpful tool if you want to in detail understand what's our situation with, for example, the condom program, or with the key population program, or programs for young women. Next slide. Prevention cascades have been discussed, and there is a broad range of cascades available. One concept that was particularly discussed during the outcome monitoring workshops with, for example, country examples from Kenya and Nigeria is the coverage cascade. And the coverage cascade is actually looking at a flow from somebody being initially reached with prevention or with the availability of actually prevention to them, and then tracks the contact, whether they were actually reached, or as you see here in this flow diagram, whether they were in touch with the outreach. And then the last step of that coverage is the utilization coverage. So you have basically in those visualized bar charts for levels, the required coverage, then who actually has availability, who has contact, and who then actually uses the prevention option. And that, of course, has a number of advantages in terms of, analyzing the flow of programs, on where do we lose people, where do we have the biggest gaps? Do we need to work on availability or more on demand, on enhancing our contact? And it also allows to apply an equity lens to understand, among which groups we have larger gaps, can of course be focused on specific subpopulations. And the flow diagram here, I think, gives you a very nuanced understanding of prevention, where we have some people who may actually, be following the classic cascade. They have availability, they are reached by outreach, and then they use condoms, or we also have ART here represented. But you also have other patterns of use where people might not necessarily be used by outreach, but still have, a utilization of the prevention option, because maybe they have, taken the initiative themselves to collect it from a facility, or to maybe buy it from a private sector outlet. But you can also clearly understand where the gaps are of people who are, not reached by outreach, but also not using prevention, where, of course, there will need to be a focus of programming. Next slide. So we have, of course, also broader guidance on prevention cascades that follow a similar logic, and this is the document that is represented here in this slide. You will also find it on the GPC website. We saw in that workshop actually two different models. There is a classic UNAIDS program cascade that follows pretty much the steps that we saw on the previous slide. We have, a denominator, the people at risk of prevention and eligible to use a specific intervention. So it could be people with non-regular partners for condoms, then the people who were actually reached by a program, the people who used the intervention, and then the people who used the prevention option consistently. The difference to the Harare prevention cascade framework that was presented is that it also includes factors like motivation and access. You see it here represented in small at the bottom right corner. So that considers additional factors that are actually determinants of prevention use. So if you like, the UNAIDS cascade and the guidance is a little bit closer to the treatment cascade, where we just follow specific programmatic elements, and this one goes deeper in addressing some of the underlying motivational and access issues. For both cascades, we have, and that's what you see here in the background, also the opportunity to do combination prevention cascades. And perhaps this was one of the main innovations presented from the Zimbabwe experience, is that we now have, through surveys, the opportunity to actually ask questions about people, whether they are at risk, and then not just about one prevention option like condoms, but all the prevention options they may have used. And then one would have a more comprehensive view on who is reached by, one or several options, uses one or several options, and who is missed out by any of the options. And that, in line with the new targets that we have for combination prevention, where we say, it's no longer a single option, but we want 90% of people use one of the effective options. We now would have, of course, the opportunity to measure that. The challenge, of course, and that maybe relates back to Annette's presentation, of course, we have relied on DHS surveys. We have often relied on IBBSs. So we'll need to find much more cost-efficient ways in places where we don't have the same level of frequency of these surveys due to the funding situation. So, of course, a number of questions on feasibility of doing these more advanced cascades that require surveys. But one can also still use the cascade visualization based on the program monitoring approaches that Shona described, which do not rely on the surveys. Next slide. So last but not least, and this maybe takes us one step back, which is actually who needs prevention and what tools do we have here? Because, of course, you could have a lot of people using prevention, but if it is not the right denominator, the right people, then the impact will be minimal. And that's why there has been quite a bit of focus actually to also better understand the denominators of prevention, which according to a consultation we held about 2.5 years ago, has 2 steps. First, determining a total population size, and then secondarily calculating a risk-focused denominator. So the first step would be, for example, all the adolescent girls and young women in a district with higher HIV, but then the risk-focused denominator would be, well, for specific interventions, for example, especially the more resource-intensive interventions like PrEP or individual community outreach, one would actually focus on the people at higher risk, and then that would be, for example, young women with non-regular partners. And then the SHIP tool that is represented here, just to follow through on that example, would provide those specific incidence estimates for all the districts for this behavioral subgroup by age and by sex, and then help also determining the population size. So the value addition of the SHIP tool to what we used to do previously, where we just looked at incidence and maybe through the Naomi tool at subnational incidence, is it really that it makes that additional step of providing these behavioral disaggregations, and then associated with that the population sizes of the groups that require prevention, access to prevention options. So it's one step from previous programming, and it has been used primarily for global fund related development, for examples for GC7 proposals for prioritizing prevention focusing program for adolescent girls and young women, but it can of course be done for all age groups, and should probably be, in an ideal setting, be done for the entire population in countries with higher HIV incidence, so that the populations with highest incidence, regardless of age, are actually filtered out. And that would be the recommendations for using the SHIP tool to really look at it. And you have those colorful diagrams there and tables that nearly sort of incidence maps that help to determine the focus of prevention programs. So of course, there's a number of specific tools and for specific interventions, but I won't go too much into detail on that. So analyses like the SHIP tool can then, of course, and should be feeding into PrEP target setting. And there's a specific tool for PrEP target setting. And we had actually very detailed presentations there. So if you're interested in those areas, please, through SSLN, look at the more detailed presentations, or we can also provide them on prevention denominators. So this slide actually summarizes probably 50 slides that were in the actual meetings. And then, of course, we have other tools like condom needs estimation and other needs estimation tools for specific interventions as well. Thank you. So I think I'll end here with this. Of course, we're in a very resource limited setting, and integration is the spirit of much of that. And we'll try to do that as much as possible. So for example, what is on this slide should ideally become integrated with the annual estimates process, where countries through the spectrum model actually do their estimates. We should actually develop those prevention needs estimates, which could be, on the one hand, the denominators in terms of the people, but also in principle, the coverage and outcome targets for countries. And that would be a leap forward. So stay tuned for these upcoming estimates processes. We want to start integrating this prevention needs estimation more systematically into that, and thereby also maybe reduce a bit the complexity of the tools. Thanks so much.
Yeah, thanks so much, Clement. It's so great, very clear presentations. And I also want to appreciate the fact that you ended this presentation by emphasizing integration and also answering the question for us, who needs prevention? In terms of the steps we require, the 2 steps we require to be able to determine the denominator of who truly needs prevention. Thank you so much. Once again, I want to encourage all our participants to utilize the Q&A as well as the chat box to share your thoughts, comments, and questions. And also to encourage us to look at the chat box. And our colleague Lamek has provided us a link to the prevention outcome monitoring workshop reports, both in English, French, and Portuguese. I would just want to encourage each and every one of us here who have not had access to that report to utilize that link and ensure that you have a review of the report. Thank you so much. And I just want to also thank our panelists who are creating time to reflect and also to respond to some of the questions in the Q&A. I also want to encourage our panelists to look at the Q&A and see if there are questions there that they would like to respond to. Clement, I'm thinking that there are 3 slides you needed to look at. I don't know whether you looked at those 3 slides before you concluded. Clemens, are you there? I thought there are 3 slides you needed to look at before you conclude. The key insight and action and then before we hand over to our colleague Tamike, can you just, Clement, quickly go through those 3 slides? The prevention outcome monitoring. Yep, this is before us.
Thank you so much. Yeah, okay. So thanks. And yeah, apologies. I've been taking over from my colleague Lysias, who has just been called into another meeting. So prevention outcome monitoring is of course important, but not easy. It has the power to improve program planning and enhancing accountability. So it helps identifying gaps and strengths. And this requires, of course, above all, accurate and timely data on prevention outcomes. And of course, one key question I mentioned already here at the moment is, how can we do this with limited funding at the moment? So there is clearly in many countries an intention, but we need to continue actually coming together to enhance in-country capacity, particularly now when we actually also have a scarcity of technical support budgets at the moment. And we of course have, and I spoke to this already, probably quite a large number of tools, and it's not always easy for countries to understand which tools are the right tools to be used in a specific context and setting. And we have actually presented at the meeting some maps of tools that can help that. And I understand the SSLN is also working, or the I2I team is working on actually orienting and this use of tools and which tools are useful for what purpose, and communicating that to countries as well. Next slide. So clearly it is a moment of opportunity for HIV prevention outcome monitoring. We have a lot of tools and more granular data and estimates actually than ever before. We have, electronic health records, mobile data collection tools, AI as a future opportunity. We have all these different survey tools, these outcome monitoring tools that Annette has presented, and they actually present quicker and cheaper methods than we had previously when we just were relying on the more expensive, high quality, but more expensive population-based surveys. Community-led monitoring can be leveraged more for prevention outcome monitoring. It has been successful in enhancing data quality, but often has not necessarily included prevention to the same extent as HIV treatment outcomes. So there is certainly an opportunity here, and will also requiring integration with national M&E systems at this stage. And Countries, of course, can learn from other country experiences, and I think we had a lot of that happening in that meeting. And I'd also like to encourage you through the SSLN platform and meeting report and documentation to explore those examples more. And you saw even in this slide deck some of them: Zimbabwe cascades, Nigeria, use of PSATs at subnational level, really a lot of examples. Next slide. So there were also a number of important commitments that arose out of this workshop. Countries committed to complete their action plans with clear timelines and deliverables. Through their global fund action plans, countries will plan to implement one of the outcome monitoring tools within the next funding year, which is, right now actually running since this workshop, which happened last September. Countries will be accountable to their action plans submitted to the SSLN. Global convening partners were agreed to develop and disseminate a consolidated report. WHO will support countries to complete and submit their data dictionaries. The SSLN will develop a data decision toolkit through I2I, and the Global Fund will follow up with countries on their action plans and engage with countries when requested. Thank you. So I don't know if there's any additions, since a lot of these actions were for the Global Fund specifically or for the SSLN. So I rely on those colleagues to point out any additional things they'd like to highlight, but that's it from me. Thanks so much.
Okay, thank you so much, Clemens. Very grateful that you could create time to also provide clarity on those 3 slides. Very, very important slides. You certainly agree with me, particularly the last slide that present to us the key consensus and agreement and responsibility for both countries and partners arising from the prevention outcome monitoring workshop. Thank you so much. There again, I want to encourage participants to utilize Q&A to indicate their comment and questions, and also to ask our panelists to take a look and prepare, either respond or prepare and be in readiness to respond during the session on Q&A. Thank you so much. As we hand over to our dear friend Tamika, fellows who is with SASA Learning Network, to take us through the I2I platform and to see how it can introduce us more to the data, HIV data-driven decision maker, DDM. I had a privilege of attending a session on I2I just yesterday, and I can assure you that it's quite a very, very powerful and useful tool that can make a lot of difference in terms of informed decisions. Over to you, Tamika. Thank you so much.
Great. Thank you, everybody. So as part of one of the outcomes coming out of the Prevention Outcomes Monitoring Workshop that Clemens has just spoken about was for SSLN I2I to develop a decision toolkit. And so that is what we are calling the HIV data decision maker. So during the last Prevention Outcome Monitoring Workshop, we found, and as you can see on today's webinar, there are a lot of toolkits, dashboards, guidelines that are really useful and important tools that can be used to support HIV programming. But these tools are scattered across multiple different sources or sites or organizations, and there's no easy way to access them all and no clear guidance on when to use each tool. So SSLN I2I gathered all the data, toolkits, and guides that were shared during the last Prevention Outcome Monitoring meeting, as well as looked for additional resources to fill some of the gaps or ones that we knew about that existed elsewhere. And we compiled them into an HIV data decision maker, which is a centralized resource for HIV-related data analytics and tools. So the HIV DDM is designed as a go-to tool to navigate key data sets, practical guidance, and tools and best practices for M&E for HIV programs. Next slide, please. This tool simplifies access to relevant data and resources through an easy-to-use decision tree structure. So the tool is based in PowerPoint, and to access the full features, it should be used in slideshow mode, which I think is the default when it's downloaded from the Eye2Eye website. So users are presented with questions and buttons that they can click to allow them to navigate the tool or dashboard, navigate to the tool or dashboard that they need. Through this decision tree, the tool helps users navigate to the right tool based on their program needs. It also helps users to understand when to use which tool and provides them with the most up-to-date data sources or toolkits that can be used to measure and assess the real-world impact of HIV programs. As you can see here on the right-hand side, there is an excerpt of the first page in the DDM where you can choose to either explore existing data resources or you can learn how to collect new data. Next slide, please. So the HIV DDM is split into two components. The first component is a data guide, and the second component is a toolkit library. The data guide houses links to external data sets and dashboards like AIDS Info and the DHS Stat Compiler, amongst many other dashboards that are useful. The toolkit library houses links to best practice guidance for collecting new data or setting up M&E systems. Many of these tools have already been presented today. Both of these sections are intuitively divided into a decision tree, which guides you to the resources that you need based on your answer to the question at each branch. Both of them start with data for program planning and have a number of different branches from there. And they also have a main branch for data for program monitoring, and then a number of different branches from there that then gets you to different links that you need. Next slide, please. Great. So as I said, it's structured as a decision tree. And so if, for example, you're looking for information on the HIV epidemic to inform a literature review or develop an HIV prevention strategy, you would go to the data guide to explore existing data sets. You would then go to data for program monitoring or data for program planning. So if you choose data for program planning, you will then be redirected to another sheet, which then asks you if you're looking for data to understand the HIV epidemic, or if you're looking for contextual information amongst key population groups. Given what our need is, we would choose data to understand the HIV epidemic, and that would then lead us to another page, which would then ask us if we're looking for to understand the HIV epidemic amongst all population groups or just specific key population groups. And that would then take you to AIDS Info. So that is a dashboard displaying the latest national HIV estimates on diagnosis, prevention, treatment, policy, and finance, with each indicator presented individually at one point in time. So the HIV DDM also summarizes what the tools are and how they can be used at different points in the decision tree. All of these this tool provides access to external resources, and if at any point you get lost in the decision tree, you can go to the back, you can press the back button or the home page, which will take you back to the relevant sections. Next slide, please. Great, so SSLN Eye2Eye has also developed an explainer pager. So if you ever want to find out more about how this tool can be used and who it's appropriate for, that can all be found in a PDF document that can be downloaded and used alongside the HIV DDM. It also has an interactive map. Well, it has a map of the data decision tree so that you can see exactly where the different resources would be housed. Great, thank you so much for listening to this presentation today. If you enjoy and if you have used the HIV Data Decision Maker, there is a survey link on the latest version of the HIV DDM, which has been uploaded to the data portion of the Eye2Eye site today. So please do feel free to download that. I see Lamek has just shared the link in the chat as well. And so if you have used it, please feel free to tell us a little bit more about your experience with using it on the survey link. And yeah, thank you for listening. We hope that this tool is really useful to you. Thanks so much. Back over to you, Gabriel.
Thanks so much, Tamika. I mean, I know that the time allocated is not enough to do justice to the very robust and important tool you have introduced to us. And so I would just want to encourage our participants to look it up and follow through. Links have been provided in the chat box for us to have greater access and understanding of that tool. Basically, it's quite a very useful one. And so we just, given the time available to us, we just quickly move on to the Q&A section. And under the Q&A section, thank you so much, panelists, for responding to some of those questions in the Q&A. But I also just want us to highlight some of those questions that have been asked that have not been responded to. And I want the panelists to note and to ensure that we'll provide you with 3 minutes each to respond to some of those questions that you have not responded to. So there's a particular questions I would just want maybe Ben to take note of, probably when the opportunity is provided for you to just also respond to reclaim. We want to know how the CLM models, our friend Derek asked that question, how the CLM model is managed outside of the national MIE system. How easy can this tool be integrated moving forward? What is your thought on that? I mean, that question keeps coming up. I would just like us to also know your thought on that. Also, another question between you and I don't know who best to respond to it. How easy it is, this question is from Rosemary, how easy it will be to apply these tools and integrated platform as we move towards mainstreaming HIV in primary healthcare, universal healthcare coverage with minimal resources for implementing HIV-specific intervention. So he's talking about those tools that are HIV-specific, how easy they can be consolidated and integrated within the context of HIV and primary healthcare integration. There are other questions that are there. Tamika and Redrick, I don't know who you can help. You can read some of those questions that have not been responded to. But thanks, Shona, for responding to some of those questions. Thank you so much for that. And I'm just going to ask, are there any specific questions you have picked, Tamika and Redrick, that you want our panelists to note before I hand over to them? Quickly read the questions out, please. Some questions are either in French or Portuguese. My understanding of French is still very primary and rudimentary. And so probably you might just help with an interpretation if need be. But thanks so much, Shona, for responding to some of those questions. And so I will just open it up for our panelists to respond to some of those questions that relate to you. But I know that some have been responded to in the Q&A session. So Anne, over to you. You have some feedback you need to provide on some of the questions raised?
So if I can maybe go ahead.
Yes.
Yeah, so so Mateo's comments on if we have more data on the costs. Unfortunately, not yet. Mozambique is the only country that now has implemented, and we haven't received their cost data yet. Indonesia, Uganda, and Tanzania are all at earlier stages, but yeah, very important because we only have the pilot cost data, and yeah, that's a question that comes up more regularly, but hopefully more later. In terms of frequency, I indeed didn't mention it during this presentation. The idea was actually that the methods would be light enough to be conducted on an annual basis to really be useful for course correction each year. The way that countries are currently approaching the work is still too large, too big to really be done that frequently. So then biannually would potentially be an option, but we really hope that with further work, we do get tools available. As I indicated, we want even lighter methods so that we can do it annually. And that might lead into, there were actually two questions which might not purely be directed to me, but I think they're also relevant on like integration into primary care, both an English question and one from Côte d'Ivoire in French, which both relate to using tools in integrated settings. So if we're focusing more on measuring prevention outcomes in primary healthcare facilities, then we might start look at kind of having short surveys when either people are entering the service or exiting the services, just to monitor over time what their use is of prevention options. And that would mean kind of more like throughout the year, collecting that type of information. I think that were the two questions. I don't know if there's new questions that appeared, but let me first hand over to my colleagues to see if anything else came up that was directed to me.
Thank you so much. Shona, over to you, 3 minutes. Thanks so much for responding to some of the questions in the Q&A as well as in the chat box. But just 3 minutes in case you need to amplify any of them. Thank you, over.
Thank you so much, Gabriel and colleagues, for your questions. I'll just address two questions or the bigger context around them. So the first is on the types of populations, and in the question specifically referred to serodiscordant couples. We wouldn't suggest distinguishing prevention options based on, you know, the type of risk. Risk for HIV is varied, it changes. And so anybody who either perceives themselves to be at risk or is in some way documented to be at risk for HIV should be offered a prevention option that best suits them for their context. So I just want to make that clear. From the monitoring perspective, it's useful to capture that risk to understand who out of the people who need prevention are then getting prevention, because that's a real critical part for the outcome piece, is to know that you're reaching the people who really do need that service. So I've put in the chat and in the Q&A where you can find some of that information in the SI guidelines. The second set of questions is around integration or primary healthcare, UHC, and questions around that. And I think for that, again, you know, there are things that you can embed into the National Health Information System for people who are at risk in the general population. This is much harder to do for key populations. And so other approaches that reach and monitor key populations are important to include as well. So just to say that there's a balance, and you know, the nice thing about this group is to put together a whole range and suite of tools that can be used based on the programmatic question at hand for the country or for the program that's implementing them. So if it's a key population setting, for example, like the Côte d'Ivoire question, you know, if the question is trying to, you know, where and who are these populations, you can use something like the BBS Lite. Probably the routine health information system may not be so helpful, but a prevention tracker that's identifying and you know, prevention need in certain populations is something that you consider, as well as some of the other survey-based approaches that Annette was referring to. So I just want to say there's no one size fits all for prevention monitoring. And sometimes, depending on what you're trying to answer, several of the different approaches may be useful. Over.
Thank you so much. Thank you so much, Shona. Ben, Clement, please, can you just take 3 minutes on response to any question or give us your own closing thoughts? Indeed, 2 minutes. Clemens.
Thank you so much. Thanks so much. On the questions in the chat, well, community-led monitoring should, of course, remain independent, but integration into national M&E systems could mean regular feedback loops into actually interpreting the data and coming together, sharing community perspective, validating national data and having that exchange. There's one more question on key populations and the Global Prevention Coalition. I think it's a very fundamental question on the future, not only of key population related outcome monitoring, but the programming. In very brief terms, countries are in very different stages, and some countries have key population programs that already have some domestic financing. Of course, in sub-Saharan Africa, a large majority of key population programs have been depending on international financing. And that is where I think probably at the moment the real sustainability discussion is needed, sustainable models. Often we've had fairly expensive project models for key populations. If there's any advantage in this at the moment, then it's fairly small populations. So if we rethink the entire model, like outreach for key populations, maybe through cost structures or approaches that we use for other community health workers, so peer-led outreach for key populations using such modalities, not through the community health workers, but peer-led outreach workers maybe working under the same or similar conditions. Or there could be more cost efficient methods for running drop-in centers through using existing community infrastructure or rooms. Or there's a number of implementation models, for example, where specific primary healthcare providers at specific times or in specific places provide services for key populations and build that trust. It takes a major effort, a major thinking, conceptualization, and transition effort. We have actually done a review of sustainable key population models that we will release in the coming months. And maybe there's some inspiration, from that. Yes, so as the Global Prevention Coalition, we are planning also a separate webinar on this, in the coming months. So maybe I leave it at this.
Yeah, thank you so much, Clemens. Very grateful for those insights. So I would just want to take the closing remarks. Our dear friend Tom Ofem is going to take us through the closing remarks. Once again, thanks so much. 165 participants at the peak, and I'm so grateful that we have more than 100 that have stayed on up to now. Thomas Ofem, please, over to you for the closing remarks. Thank you.
Thank you, Gabriel, and thank you, everyone. My name is Thomas Ofem. I'm the Western Central Africa Regional Lead for the SSLN. And it's a pleasure to be able to be called upon to close this webinar. What we have done here is basically to repeat a 2.5-day workshop that held in Botswana and bring it here and complete it in 1.5 hours. So we appreciate that we all have lots of questions. There are a lot of preventional community tools that have been shared. But we encourage everyone to take advantage of the WHO website, the GPC websites, and the SSLN website, and all the links we have shared here to answer some of the questions you have and also take a deep dive into these tools. I want to thank our panelists, Annette, Shona, Clemens, and of course, Gabriel, and also the SSLN I2I teams for putting this together, and hope that we will get together in future to discuss this again. Once again, thank you very much for the time you have taken to attend this webinar. We will definitely share all the materials to all the participants. Thank you and have a great evening or afternoon ahead. Bye.
Thank you so much, Tom. And from my desk, I'm very grateful for the opportunity to moderate. Very grateful for that. And thanks all of you for a very wonderful session. We look forward to another session in the near future. Thank you so much. Thank you.